Good morning. So as a continuation of Shirley's work on human side, we're going to go from human to mouse instead of mouse to human. But I think as we try to delve into a bit more mechanistic connection between these antibiotic, microbiome, metabolome to effect in human. This work I'm presenting is the basic project that is principally a collaboration between our group and Victor Nizet's group, but also has extensive collaboration with Shirley and Peter's group also. And it's spearheaded by Fatma Askarian, who's a adjunct assistant professor in Victor Nizet's lab. Let's see, advancing this. Okay. So for the past 5 years, the focus of our research in the mice was to ask the question how perinatally administered antibiotic through the breast milk or transplacentally affect human infant health, okay? And how this is translated through gut microbiome or metabolome. So there were two effects that we found, and one is increase in pup weight, which Shirley has mentioned previously. And the other one was that there's a decreased vaccine efficacy of those mice that were administered certain antibiotic. And this is the focus of the talk today. So what we try to work on principally here is two antibiotics. Ampicillin that Shirley showed before, which is an antibiotic given for GBS prophylaxis abundantly to many newborn and subsequently in the form of mux to ear infection, etc. And then there's the augmentin, which is a broader version of ampicillin. So we give these one to the mom during the last few of gestation, and also continue on for first 7-day postpartum. And then we try to measure the effect of this on infant gut microbiome and metabolome, and also on how this affects immune response to pneumococcal vaccine. So here's the experimental setup. We give the antibiotic in drinking water, starting late prepartum on E16, and continue this one all the way to the first week for a total of about 10 days. And subsequently, we vaccinated the mice, the pups, on week number 2 and 4, and then we collected blood sample and stool sample throughout all the way up to 10 weeks. And here are some of the results, okay? This is the serum IgG titer against strep pneumo. As you will see on the right here, there's a sham, so those mice did not get the vaccine, and therefore, as expected, you don't see any titers or antibody to the PVC20 vaccine. But in the group that received vaccine and did not get any antibiotic, you get a nice, robust antibody titer to pneumococcus. Those that received ampicillin were slight decrease, but not really significant. It's most marked with the group that received amoxicillin clavulanic acid, which is the broader antibiotic. And that caused a dip in antibody titer at 4 and 6 weeks with restoration by 8 weeks of life. So we asked, how does drop in antibody titer translate into function? And we use an opsonophagocytic assay to measure function here. So in this assay, we added the serum from these mice to strep pneumo and added some myeloid cell and measure how strep pneumo are killed better or not in the presence of these antibody. So this is at 4 weeks of life for these pups that's been not vaccinated or vaccinated here. And as you can see that there's preferential killing of these bacteria if they have not been pre-treated with antibiotic, or if they've been treated with ampicillin. But in the group that where you saw the dip in antibody titer, the amox clavulanic group, there's much less killing effect at 4 weeks, okay? And you see this again at 6 weeks, exactly same pattern here with ammox clavulanic acid having this depressed response of vaccine compared to the AMP group of a control group. By the time you get to 8 weeks, where the antibody titer is restored in all the group, you see this effect going away. So in other words, what we think is happening is that the antibiotic pretreatment with a broad ammox clavulanic acid drive the depression of the antibody titer from the vaccination. This leads to a depressed OPK and functional responsiveness of a vaccine. So with this, we ask the question, how mechanistically? And this involved a lot of collaboration with Shirley's group and Peter Dorstein's group in the analysis of a microbiome in Metabolome. And it's going to be interesting. You're going to see some of the theme repeated earlier on that you saw in Shirley's data with ampicillin, ammoxiclav, especially ammoxiclav having a deeper effect compared to the ampicillin. You're going to see this reprised again. So these mice were, the fecal sample were collected at week 1 and prior. This is the period when antibiotic were given. And then at 2, 4, and 6 weeks when the 2 and 4 weeks when the vaccine were given. So we're asking the question, what was different in the microbiome in Metabolome at the time vaccination were given that led to the changes in antibody titer and functional differences? So what do we see? So this is a PCA analysis of the microbiome. It's a complicated plot here, but these are on the left for plots for the dams and the right for the pup. To make it clear, focus on the color. The red and pink are antibiotic treated group, whereas the blue are the non-antibiotic treated group. And you can see clearly there's a separation of antibiotic compared to the non-antibiotic group here in both the dam and also the pups overall. What you see here in a little bit more detail in the Shannon diversity analysis is that in the dam, in no antibiotic compared to the antibiotic treated group, there's a depression in the level of diversity here in the dam. This is also seen in the pup, although the significance is only seen with the ammoxiclav group and not with the ampicillin group compared to the control. So then correlating well with the data we saw already with a functional assay. Looking further at what microbe potentially could be responsible for these, looking at this correlation a bit deeper. And here's an abundance analysis of specific orders of bacteria. Here we compare the ammoxiclav versus the mock group that has no antibiotic group. And this reflect on the blue side, increased abundance of certain bacterial orders on the mock group versus increased abundance of relative abundance of those for the antibiotic group with ammoxiclav. Here's a dam, these are pup. By not going into the detail on the specific order, but I want you to focus on 2 bacteria, Bacteroidetes and Coriobateriales. These are, interestingly, bacteria that you also see on Shirley's presentation previously in the human. Okay, these are the bacteria that have been correlated with supporting antibody production in previous one. And here you see that these are increased, are more abundant in the mock group and reduce when you treat a ammoxiclav group. Okay, so this is kind of very nice in terms of supporting that. Now looking at that, it happened during week 2 all the way to week 3 and 4. They're persistent in these differences that carry on with the vaccination. There are other bacteria that are favored with the antibiotic group, but I won't go into those. But these correlations appear to be strong. And what's interesting about when you compare ampicillin versus mock is that don't worry about all of these names. you don't see this Bacterocardiale group or Bacteroides group compared to that. So in other words, we see a differential effect on the microbiome of the amoxiclav versus ampicillin. And those differences seem to be group of bacteria that seem to support antibody production. So going forward with that, here's now extending that analysis to a multi-omic comparison. These are untargeted metabolites, some of the top 10, and then how these correlate to certain bacteria that we mentioned before that were favored out of these analyses. So there's Bacteroidales and Coriobateriales also that seem to be depleted in the amoxiclav group. And those seem to have fairly strong correlation to 8 different metabolites from these untargeted metabolites. And 6 of 8 are from the tryptophan derivative. And tryptophan derivative are immune acting, immune modulatory. So it's quite interesting that this correlation because they have been implicated also in vaccine responses. Looking at this more closely, here's some of those tryptophan derivative here. And what you see is clearly that in a mock group compared to antibiotic group, there are differences in depression in the level of these tryptophan here. And this is particularly significant in terms of you look at the p-value for amoxiclav group compared to the ampicillin group. So implicating potentially for some of those role of these tryptophan derivative in mediating some of these vaccine response differences. So going forward with some of other metabolites that was looked at, here are metabolite, general PCA for metabolites from the mock versus antibiotic treatment group. And there's a clear separation from the mock versus antibiotic, whereas the 2 antibiotics seem to be overlapping very closely. Looking at some of the metabolites that have implication in immune modulation in vaccine development, here's some of the bile acid. We talk about microbial bile acid. And this is from the DAM, and I want you to focus on ampicillin and amoxicillin in the early time point. There's a clear difference between these versus the mock. And this difference slowly go away over time as you expect it. There are some more subtle difference between even ampicillin and augmentin group, but those are more subtle compared to those from the mock group. This happened in the DAM, and this also happened in the PUP, as you can appreciate here compared to here. And again, after 2 weeks, this difference starts dissipating. Beyond that, we also looked at some of those other metabolites that are implicated in other vaccine function. These are a short-chain fatty acid, the N-acyl-lipid implicated in some T helper function. And you can see here that here's the PUP and here's the DAM, ampicillin, amoxiclav, and mock. And what you see is with both all the antibiotic treatment group at 2 weeks, where it start a much greater difference compared to those of a mock group. And this we cover by 3 or 4 weeks of life. So again, the time frame seemed to fit a lot of these being intensely much more different during the period when vaccines are given and could have this implication on how they affect vaccination. Another one is the acyl-carnitine group, again, fueling energy mitochondria that's needed a lot for these bursts of T and B cell responses. We see the same pattern about antibiotic driving more sharper difference compared to the mock group across the PUPs and DAMs also. So the broad message here is that the broader antibiotic seem to weaken the neonatal vaccine responses. Amoxiclav has a stronger response and to weakening these vaccine response compared to ampicillin. And both antibiotic can have significant effect on microbiome metabolome responses. And we actually see very specific orders of bacteria that are shifted or changed, especially in the broad antibiotic group, that correlate well with the vaccine efficacy responses, antibody responses. And these are associated with some metabolites that have been previously implicated in immune regulation. So in this field, so far, how that really works is not well appreciated, but we're starting to make lead headway into the more mechanistic aspect of how metabolites specifically affect the antibody or T cell responses to drive down this efficacy. Related to that, it was interesting. When we started this project, there were just some hints of how vaccine in neonatal and also adult seem to be impacted by treatment with antibiotic. For example, on the right is a Cell paper from Bali Budon-Landren's group, where they show that rabies vaccine in human, when you actually give it to volunteer, and they assess how that antibiotic actually changes those responses of rabies vaccine. And they see that it does perturb immunity, that decrease the efficacy of vaccine. And there's a pediatric paper subsequently that's shown that those children in the first year, especially of life, 5 different antibiotic and on various vaccine courses of antibiotics seem to have changed the efficacy, reducing the efficacy of some of those vaccines. So those are correlative study. Now we're having more of the study into mechanism. An interesting study on the left side, which also popped up, where they show also like what we did in early life. What they focus on is on neomycin and ampicillin. That combination given to neonate seemed to change 5 vaccine responses, reducing the IgG level and also depressing the level for up to 8 weeks or so. So there seemed to be some in this burgeoning field that increase antibiotic treatment having effect on host immune response in the neonate. So our next step in evaluation is to ask for us, those more commonly used antibiotic, what's their effect? How does the duration impact it? And also, potentially more interestingly, how can we give probiotic to modulate this effect, to block this effect from happening? And if we know the metabolite, how we can even give these metabolites to abrogate these effects. Of course, if we can avoid these antibiotics first, that would be the first step. So with this, I want to acknowledge folks who have contributed to this work. Again, acknowledging Fatima Askarian from Victor's lab, who spearheaded this project. And then Shirley's group, also folks from both our lab. Thank you. Coming up with